Good morning, everyone. This is Juan Gallardo with another session of iPros TV. And once again, we're excited to enlighten you, to provide you with wonderful information around all the programs that we offer here at iPros Insurance Professionals. And today we have Angie Karr-Nystom with Welbe Health. And she's going to share with us information regarding the program of all-inclusive care for the elderly, also known as PACE. Welcome.
Thank you. Thank you so much for having me. I'm really excited to be here and be able to share PACE programming with all of your agents.
Awesome. And I reached out to some of our agents prior to the session, and I was really surprised, one, how many of our agents are not familiar with the PACE program. And those that are unaware or were unaware that they can now get paid to help educate and enroll individuals into the PACE program. So we're really excited about hearing that information. How long has this been approved that they can now get reimbursed at the CMS Medicare rate?
It's only been a couple of years, actually. Probably a year or so before we even took on with Welbe Health. A lot of the PACE programs just didn't have the infrastructure and didn't know how to do it. And Welbe Health said, hey, let's give this a try and see how it works out. And it's been tremendously successful. Overall, Welbe Health's enrollments, 15 to 20% of all of our enrollments are actually coming from agents statewide right now. So it's very successful.
We want to increase that percentage, right?
Yes, absolutely.
And I just want to reiterate that the commissions are paid based on the CMS guidelines for Medicare Advantage plans. So in addition to that, this program is available for people that are under age 65, which is huge.
That's correct.
We have a lot of agents that do a lot of grassroots events, a lot of community events, and they come across a lot of individuals that are under the age of 65 that will most likely qualify for the PACE program. So we're excited to hear about the qualifications. So we're going to take a brief pause so that we can transition over to the PowerPoint presentation, and we will have a Q&A session at the end. So stay tuned for a few seconds. Thank you.
All right. So I'm going to explain why Welby and why it's going to be a really great opportunity for all of you agents out there, and why Welbe Health is going to be the next product your clients are going to be asking for. So just going to quickly go over who is Welbe Health. What do we do? Introduce PACE briefly. When you do the training with us, there's just a huge history of PACE and what is PACE for you to go over. So I won't go too much in detail about that. I will also talk about what makes PACE programming in general unique. And then the core differences between PACE and your MA plans. And facts, because facts really sell things with people. They want to know what are the driving factors of why people would take on these types of programs. And then also benefits to agents, because we want to make sure you know what you're going to be getting through this as well. So Welbe Health's purpose is to unlock the full potential of our most vulnerable seniors. And our core values are courage to love, pioneering spirit, and shared intention. And so any of our trainings that you go through, you'll hear these things many times. Just to know where we operate at present moment, we operate in the Stockton-Modesto area, and we are affiliate of Sutter Health. We also serve Pasadena, Glendale, Burbank. We have a center in Pasadena. We also serve Greater Long Beach and South Bay area, and we have a center right in downtown Long Beach. We also have a center in Fresno, which is also downtown Fresno and serves a very large area. And coming soon, we're going to be opening up our center in North Hollywood, which will be serving the San Fernando Valley, as well as our center in Rosemead that's going to be serving the San Gabriel Valley. And coming soon is also going to be San Jose. So it will be growing. There's going to be lots of opportunities to sell in different areas. So with PACE programming, we provide all-inclusive medical and social care. So it is not just one thing, it is several things that our teams are doing. So we are a medical care team. So we have primary care on site at all of our centers. We also have several other professionals. So we have physical therapists, occupational therapists, dietitians, RN case managers, all on site to help our seniors and their families navigate the medical system. Prescriptions, we cover them 100%. And we have no formulary. So I know that's really big for a lot of our agents when they're looking at plans. Since we have no formulary, as long as something's medically necessary, we are able to provide that. And all of our prescriptions are home delivered. And there's no copays for our seniors either. Home care. So our home care is provided in our seniors' homes. We do home care assessments to assess those needs and what hours numbers that they are going to get. I am going to wait here on the IHSS to the end because I know there's a lot of questions around how our home care and IHSS work together or not together. So I would like to wait to the end to go to that. Then social engagement. Our seniors, we have a senior center essentially attached to our medical facility. And our seniors are able to come in, have meals with us, get social engagement, do activities. We also do virtual activities. So all of our seniors do get a grand pad to use at their home for telehealth and also the social engagement programs. Care coordination is a really big thing for PACE organizations in general because of the number of steps many of our seniors who do have chronic conditions are having to take to make appointments, transportation, and then just the two professionals or specialists talking together to address a concern. We have full dental, vision, and hearing. So all of our centers have dental clinics within them. So there is no cap on those services. We do dental includes your cleanings, extractions, fillings, partials, and dentures. Eyeglasses are covered, as are hearing aids. Exercise, we do have our physical therapy gym, which does have equipment in it, but we also have exercise classes in person and on our grand pad. And transportation is 100% covered. There is no cap or limit on the number of transportation rides given to a senior in a given month or year. The vans are our vans and the drivers are employees. So there's no competition with any other providers to access our services for transportation with our seniors. So at the heart of all PACE organizations is our interdisciplinary team. It is a team of professionals that you see here listed around the elderly gentleman. They are there to help navigate our seniors and families through the aging process and linking with appropriate services. A lot of people will ask, well, is this new? Is PACE new or is Welbe Health new? Welbe Health has been in operation of business for a number of years now, but the PACE model has been around for over 40 years. So it's a very proven healthcare model for our seniors. It cares for elderly, Medicare eligible as well as Medi-Cal eligible, socioeconomically vulnerable. So you're going to be your Medicaid people or Medi-Cal here in the state of California. We also are a health insurance, a provider, but we also offer the long-term care services that a lot of our families need. And we also provide all medical and social services. So that does include if they need to go to hospitals, rehabilitation centers. It's all about keeping them safe in their home. So we are the insurer, like I mentioned. So we are a Medicare Medi-Cal plan or also a Medi-Cal only plan. We cover all specialists, procedures, hospitalizations, long-term care. We are also the provider. So we do have our own panel of primary care. This does tend to be a little bit of a discomfort zone for many of our agents as we are changing primary care providers. So from who they are seeing today over to our providers. Our providers are limited in the number of patients that they're annually assigned. So 100 or less is our average patients assigned to each provider in our center. So that is an advantage in some cases for seniors that do need that extra time with the primary care or they need more appointments with the primary care. This would allow that to occur. We also have social services linking our seniors to additional programs and supports. And then every single senior that joins our program is going to get a care plan within the first 30 days. And they will also have that interdisciplinary support team guiding them through that care plan. We are the care site. So our centers do have primary care clinics. We have physical therapy and occupational therapy gym, socialization, nutritional care, meaning they get meals while they're in our center as well as snacks, Personal care is going to be, we have showering and hygiene facilities for our seniors to do their personal grooming. We also have salons on site so our seniors are able to get their hair washed and styled. So why Welby? Why now? So it is a program geared to help our seniors age in place. There is a huge push now for our seniors to stay in their homes longer. They want to actually stay in their home longer. Not that that we're pushing it. They want to stay in their homes. Our families want to keep their loved ones at home with them if they're living in multi-generational homes. We are also a Medi-Cal only program that agents can sell. So when you do get approached by an individual who is in need but has Medi-Cal only, they would be able to join Welbe Health as long as they qualified medically speaking. We have help for seniors and their families to avoid the costly long-term care cost. So when that senior does need that long-term care skilled nursing facility placement, we do help with that. Also, if it's on a rehabilitation level, we sometimes can get seniors out of the nursing home quicker than if they did not have our support. We are fully coordinated, freeing up agents and brokers from having to help seniors coordinate care. So one of the things that I get a lot from agents is that they will have clients or their families call them to try to help them figure out next steps or how to coordinate care. Since we are fully coordinated with social workers, case managers, complex case managers, there's always someone there to be able to guide them through that process and being able to make the next call, the next appointment, or just knowing what's next in their care plan or their help there. Also, we can accept partial Medicare. So that's a really big deal because some of our immigrants only have Part B and they're missing Part A. We can take on those individuals. Or I often see with veterans that they're missing Part B because at 65, they felt great and they knew they didn't have to take the Part B, so they didn't. But what I find with a lot of our veterans is when they turn 70, 75, they're having a lot more health complications. And without that Part B, they're very limited to only the VA services, which could take a long time or it's not as coordinated. So we can also help our veterans in PACE organizations. Again, really low patient counts on the doctors, 100 or less for each provider. More families need to know about PACE as an alternative skilled nursing or convalescent homes. I've been in PACE programming for a long time, and it's amazing how many families are completely unaware that this is an option to their loved one to get additional support and stay in their home. We also have a Medi-Cal enrollment team available to help your clients apply for Medi-Cal. This is a help start to finish from initial application to approval. It's handheld through that process. So we will help your client get Medi-Cal if they do not have Medi-Cal at present moment. And I've touched on the veterans, so I won't go into that again. So PACE versus your Medicare Advantage programs. PACE fills the gap between Medicare Advantage or Medi plans and Medi-Cal funding for nursing homes. PACE organizations provide services not traditionally covered by Medicare or just Medicaid alone, such as the full care planning, coordinated activities, and medical needs determine what each participant in our program receives. And I should mention there, we don't call our seniors members or clients or patients. They are participants in our program because they participate in their healthcare. So it's not just us telling them what to do or how to do it. We want them to be part of their care plan and part of their healthcare journey. And we're more successful with them if they are participating in that. In PACE, care is provided without regard to fee-for-service reimbursement incentives or restrictions. PACE never limits access to healthcare services by imposing benefit limitations. We have congressional recognition of PACE programs as a permanent Medicare and Medicaid or Medi-Cal provider. And PACE organizations provide these Medicare beneficiaries with access to comprehensive and highly coordinated healthcare delivery system. Other core differences, and I'll leave this up because this is where I get a lot of questions. PACE only enrolls the most vulnerable Medicare beneficiaries. So For us, we really need somebody that has healthcare concerns. We're not looking for the healthy folks. MA plans typically enroll a general Medicare population. So they turn 65, you start that process. PACE organizations are also healthcare providers, whereas MA plans are large insurance carriers. PACE organizations directly employ a broad range of healthcare providers. So that's where we have the physical therapist, occupational therapist, the dietitian, the doctor, the social worker. They're all employed by Welbe Health. And so they're able to talk freely to each other without barriers about a situation that one of our seniors may encounter. MA plans generally consist of large networks, and so they don't always have the best coordinated communication with each other, or there could be barriers. Requirements are to ensure that the same providers are responsible for assessing our participants' needs, developing and updating care plans, and actually providing the care. So our MA providers may be part of the same network, but are not necessarily functioning in a coordinated system. So that's where some of our seniors may have hiccups in the system of healthcare, where they are not getting everything that they need access to, or they're having issues getting or gaining access. Ongoing and intensive services to meet their chronic health and long-term care needs. And most of our MA plans do not focus exclusively on beneficiaries with long-term care needs. So that's another great difference between us. And federal regulation does not allow PACE to charge their participants premiums for Medicare covered services or any deductible or cost sharing amounts. MA plans can pass on cost and or payment reductions to their enrollees by raising premiums or increasing cost sharing amounts. So some great facts about PACE. PACE is a senior healthcare program that you can have confidence in. Welbe Health is an all-inclusive care for the elderly provider. So it's a unique way of providing the care since it's all-inclusive. So we have a huge reduction in the number of hospitalizations that our seniors have. Most of our seniors, it's one or less ER visit per year. Only 5% of all nursing home eligible PACE participants currently reside in a nursing home. So we do have some folks that reside in a nursing home, but we stay involved in their care, meaning we are the doctor of record and they are still able to come to our center for services. We also have a really low hospital readmission rate. So if somebody goes to the hospital for a condition and then they're released, and then if they go back within 30 days, we have a much lower rate of that readmission rate. PACE participants receive better preventative care, so specifically with respect to hearing and vision screenings, flu shots, and pneumonia vaccines. We have fewer nursing home admissions despite being a nursing home level of care. PACE participants have low risk of being admitted to nursing homes. This is because we can put a lot of supports in place in their home, in their own environments, to help them stay living independently at home. Most of our participants rate us very high, so 4.1 out of 5. 96% of our family caregivers would recommend a PACE program to somebody else in their own situation. And really interesting stat, PACE enrollees are less likely to suffer depression. So 27% of new PACE enrollees scored as depressed on our assessment administered before enrollment. 9 months later, 80% of those are assessed as depressed no longer. So it is social interactions with their peers and with us as their providers that they are less depressed. So that social engagement is actually really healing for a lot of our seniors. They're no longer sitting in front of a TV, just watching TV, waiting for somebody to come visit them and everything like that. They're actually engaged in day-to-day life again and coming and seeing us anywhere from 1 to 2 days a week to get their services, but also to engage socially. So I think that's just one of the most amazing stats that we have. So benefits of representing Welbe Health. Serve your community. PACE is still largely unknown and requires a lot of outreach. So again, I've been in PACE for a while, and I'm always finding somebody that doesn't know about PACE and is very interested in what PACE is. Families and caregivers need this information. It can help keep one of their own loved ones at home. Participants live richer and more independent lives because we're putting the tools in place to allow them to live at home independently. We are quick start, so we're year-round enrollment, which is great. That means 12 times a year, people are enrolling into PACE organizations. It's every month on the 1st. We have self-study courses as well as in-person class because selling PACE does require a certification, but I'm here to help you go through that process. Also, technically, we don't require an insurance license and there is no AHIP required. So though this is geared at agents, that is not always who is selling PACE. So that isn't required. So individuals, they will get $750 for their initial enrollment. That's every single enrollment, whether or not they are currently with a Medicare Advantage plan, they're Medi-Cal only, they're missing a Part A or Part B, it is $750 per enrollment regardless. So we are a true up. So when they're coming from MAPD, they're getting the $750. We also have 375 annual residuals, which start on the 13th month, and they are then paid monthly. So they are broken down into those $31.25 payments per month, and those go for 20 years. And then, because we know the training's a lot, our training program's big. And like I said, you only have to do the big one time, but we do give a $250 training bonus with your first enrollment. So just to thank you for going through that training. So just keep that in mind that you will get that $250 training bonus when you enroll your first person. So we empower you with expanded reach, competitive compensation, and the advantage of year-round enrollment. So we have a larger client base because PACE programming can actually start at 55. So that opens up those years from 55 to 64. Most of the time, those are going to be individuals that you may find that have Medi-Cal only. They may have become disabled at some point in their lives, or they were born disabled and now are aging in place and need additional supportive services. So it does open up a bigger range. We have comprehensive coverage with no copays or deductibles. So there is no copays, out-of-pocket deductibles to be met on PACE. We have a share of cost program for seniors with a share of cost with Medi-Cal. If any of you are familiar with that, that's one of my favorite parts that we go over is those individuals who are technically over the income threshold for Medi-Cal will be assessed by Medi-Cal as having a share of cost. Oftentimes these numbers are huge and they have to pay them monthly. We are able to look at their share of cost and see if we could either greatly reduce that share of cost or waive it altogether. So if you have an individual that is right there on that borderline, or, say an individual with $2,000, they would have a share of cost and they would make a great candidate for us to look at. And again, Medicare is not required. So we can take Medi-Cal only clients. We can take clients missing a Part A or missing a Part B. And of course, we have about 86% of our folks are Medi-Medi duals. So that's the given, that's the norm. All right. So how you would enroll a client, you would want to prepare your client for the process. It's longer than enrolling in a typical MAPD plan. We would want you to explain PACE programming, and that's why we do have you go through our training process so you can feel comfortable being able to explain that to a client or their family. And then, of course, I'm always here as a resource for you, so I can always answer questions. We also have a broker support line that you can call if you had questions as well. Please ensure client's interest. You would fill out an application for us. It is a 2-page application. You can also do it online and send it in to us. If you use the fillable PDF, you would Dropbox it to us, which is HIPAA compliant on Dropbox. The Welby team will do the rest. We'll schedule the level of care assessment, which is required. We can schedule tours. So if you have a client that's kind of sitting on the edge and is really not sure, we can schedule a tour so they can actually take a look for themselves, our facility, and interact with our staff and use our transportation. We also may schedule additional assessments, and I can get more into that in training. On average, it can take anywhere from 3 to 7 weeks for somebody to go through the process and be approved to enter a PACE organization. One quick thing, there's no scope of appointment needed for us, so you can do these over the phone. So if it's a client that you're familiar with and you know they'd be a good fit for us, you can do it over the phone. And again, we do programming year round. I don't know that I have the zip codes, but I can get those out to you guys. So again, Medi-Cal and your clients, Welbe Health has a team of Medi-Cal enrollment specialists to help your client apply for Medi-Cal. We also have Medi-Cal consults available. So if you're not sure if somebody's going to qualify for Medi-Cal or if it's appropriate for them, we have Medi-Cal consults that you can schedule to talk to one of our Medi-Cal enrollment specialists to get to the nitty-gritty of those details. We have step-by-step guidance on our Medi-Cal required documents. And I always tell people, please add 45 days, excluding weekends and county holidays, for that Medi-Cal processing. We have really good luck, but you never know when you're going to get that full 45 days. And then again, share of cost options are available. We also have Medi-Cal applications events scheduled at some of our centers. But if you have a top account that you want to share this with and be able to do Medi-Cal there, we are happy to schedule that and provide our Medi-Cal enrollment specialist for that event. And then we can also do Medi-Cal presentations with any of your top accounts as well to help educate any of the changes that have happened in the last year on Medi-Cal. Yeah. So success, I always tell people, look at your book of business, because you probably already have some PACE eligibles, and they may be looking for the next level of care, or they may be looking for additional supportive services. You can always keep in mind us when people who have Medi-Cal only approach you for help on their insurances. Take the opportunity with the 55 to 64 range and educate them on a new product. Partial Medicare, look at Welbe Health, because we are able to give them all services. Veterans are a big one for us because we are able to work with VA without doing anything with their benefits. And then clients calling you frequently for health insurance help or help with their coordination, Welbe Health can be a solution because we offer that full coordination of care. Social workers are assigned to every senior, and it's one call for all services. So instead of calling 3 places for a service, it is one call, and it's all of their services coordinated from one spot. All right. So that's my contact information there, my email. So you can always email me. If you are interested in contracting with Welbe Health, you can always reach out to your contracting team, who will be able to provide you the contracts and get that situated. And please watch for your emails for upcoming trainings that will be throughout the LA County area. And then I guess, are we on to questions then?
Yes,
all right.
On to questions.
We're on to questions. Thank you, Angie. Let me read them off to you. We have a question from Eduardo Fuentes. Do you have a list of all the cities that you service?
Yeah, I have a zip code list. So a zip code list is more accurate than just by city name. So I can provide that to iPros here and be able to get it out to you guys in mass numbers.
Okay. Next question. How many providers are usually at each site?
So here in the LA market, each of our centers has 5 primary care providers in each center. So right now, each of them are running under 100 for their patients counts right now.
Okay, thank you. Next question. Can you talk to us more about your transportation benefit?
Yeah, so our transportation is our vans, our drivers, so they're not competing against any other provider or any other health insurance to schedule those rides. We coordinate the transportation with them through our transportation hub. So they'll know approximately what time the van's coming to pick them up, drop them off at where they need to be. So we do transportation medically. So it's to and from doctor's appointments, to and from our center for services, or as directed by their individual care plan. So that can look a little different if it's related to their care plan.
Excellent. Oh, thank you. Another question from Farnas. How easy/hard is it for someone to leave your program if they choose to? Okay.
Oh, sorry.
She's just adding to the question. She said, I have come across a few cases where a member wanted a second opinion or different provider network, and they had a hard time leaving the program.
So it shouldn't be that hard. It should be a 30-day notice, and then they can disenroll. And anybody leaving a PACE organization does get a special election period to either go back to what they came from, or they can select a new program. We do want to know if it's a second opinion thing. I ask agents, please let me know, because if they're not voicing that concern or that concern isn't getting to the right people, I'm happy to make sure it gets to the right people to be taken care of, because I've absolutely had people ask for second opinions, and that's not a problem. We have a really good network for Welbe Health. I can actually share the website if we want to put that in there. It's
what is it?
It's welbehealth.com/ROUR-providers.
Okay, so it's welbehealth.com/
Like OUR, like R.
R.
Yeah. Then providers. And it should come up. And I don't know if you want to share it. All of our primary care providers are listed there with a little bio. And then our specialty provider network is there as well. It's under the yellow link for providers. It does show all of our centers right now. So if you're working only primarily in, say, the LA market, you might want to only focus on the Long Beach and Pasadena section of the provider network.
Did we get a chance to put that on our chat box?
Yeah, we just
Awesome.
entered it in the chat.
Awesome.
for
Great
everybody.
questions. Great questions.
Next question. Do you operate in Orange County?
We do not operate in Orange County at this present moment. Right now, we're only in the LA market, which we're having a huge expansion later this year in the LA market. And then we do Fresno County, Stanislaus County, San Joaquin. We're also going to do Santa Clara County when San Jose opens.
Okay. Next question. What are the medical qualifications?
I wish I had my cheat sheet here to share that with you guys. I should have brought it. I did bring some broker toolkits here. And so I'll leave some here so you guys can pick those up. You'll also get this toolkit in training as well. But generally, we're looking for people with some sort of chronic condition. So I'm not looking for the healthiest of individuals. I'm looking for people with out of control high blood pressure, diabetes. It could be Parkinson's, autoimmune, afibrillation, congestive heart failure. I'm looking for those individuals. And then I'm also looking for people that are having struggles in their day-to-day life, such as they're not cleaning anymore. Maybe they're having difficulty with transportation. Maybe they're having trouble with their personal hygiene because they're afraid of falling in the bathroom, which is a big fear for a lot of our seniors. So I'm looking for people struggling in that day-to-day activity, or families are not sure what to do next. They know their loved one's having issues. They just don't know what else can I do to help mom stay here? And that's who I'm looking for.
Is there a reference link that we can send post this session that we can send them via email so they can read?
I can email it to you guys.
Wonderful.
My cheat sheet. The cheat sheet is only for your eyes. It's not meant to be seen by any clients or prospects.
Is that disclosure on the cheat sheet that
It
says
is
not intended?
in the
That's wonderful.
bottom, and it's in red. So
You can't miss it.
right, hopefully not.
This is thank you, Angie. This is a duplicated question. So they're asking, does Welby take care of dialysis recipients?
Yes, we do take care of dialysis. We also coordinate all their transportation with our transportation vans for their dialysis. And our dialysis units that we're currently contracted with are on our provider network. And we can also ask for letters of agreement as well if they are outside of network.
Okay. Bianca's asking, is Welby Health only in LA?
No, so we have LA County, and I can send you out our expansion as well as our current zip codes. Fresno covers Fresno County and a piece of Madeira, Tulare, Kings. And then Stockton, Modesto covers Stanislaus and San Joaquin counties. And then when San Jose is opening, we'll cover all of Santa Clara County as well as a sliver of Alameda.
Okay. Next question. They're also asking about the Inland Empire and San Gabriel Valley. Would you be opening any?
Yeah, San Gabriel Valley is coming later this year. And I'm from the IE, so Inland Empire is coming hopefully by 2024. We have a big expansion. I'm really excited about it because we're going to be able to serve that area out going towards Palm Springs, Palm Desert, Cathedral City. So I'm very excited about that because there's a ton of need out there.
Can you give us a sneak peek on what cities in San Gabriel Valley that you're honing in on?
So I know that we have a center opening that's going to serve it. I don't know how far our reach is going to be because I have all the zip codes, but I didn't put the zip codes in to see what cities. But I know it's going to be Monrovia, Duarte, El Monte, that whole, and it's kind of like a
Their backyard.
Yeah, like a scoop. If you take a cup and you just scoop out that area from the city, it goes out that way. And then same with the San Fernando. I don't know how far out our reach will go. We do have so federal regulation states that we have a restriction on transportation, which is 1 hour each way for our seniors. So that way they're not sitting on a van for 2 or 3 hours, which can happen sometimes in different cases with like other providers.
Perfect. Next question. We have a lot of questions, which is nice. What sort of broker tools do you provide? Materials, etc. Those things.
Yeah, so initially I can provide a small amount of flyers for each individual with who's certified to sell PACE, I should say, with their name, their phone number, their email address that they'd like to use. And then as they get more referrals into us, they start getting opened up for things like getting the swag and getting the tablecloths. And, you know, because I'll take an event. If anybody calls me and says, hey, I have an event at this location, will you take it? I take it. And then I reach out to brokers trying to see who can man that for me. So when you start referring and you're getting a good understanding of PACE, then that opens up broadly for you.
Excellent. Is there a broker portal?
We're working on a true broker portal. There is a beginner portal, because again, PACE organizations have not done this yet, and so it's brand new to us and being able to do that. So it is WelbeHealth.com and then the //agents, and that gives kind of a general portal that we're using right now.
Okay. Thank you. Next question. Is the training and certification only for Welbe Health, or does it apply to other PACE programs?
So the training that we give is general for all PACE organizations as the standard, because it's set by the state of California. However, you can only have your PACE certification at present moment designated under one PACE organization. I hope in the future that will change for agents, but right now this is such a new program that I don't know if the state has actually caught up yet to, you know, what it is that agents really do. And Welbe Health is the only one really doing it right now too. So it kind of is a little restrictive on that side. So I have agents from all over that are like, oh, you're not in my area at all and I don't sell in your area. Can I assign this to another PACE organization? And unfortunately, since not all PACE organizations have a broker program, that isn't yet really possible.
So once they certify with Welbe Health, you can only help educate and enroll individuals through Welby.
Yeah, at this moment, yeah.
Okay. And it's also important to note that Welbe Health is the, as far as I know, one of the only PACE programs that is offering an agent program that includes reimbursement and residual as well, correct? Just like the Medicare Advantage plan.
Yes, residuals as well.
And someone who's on a Medicare Advantage plan but has the diagnosis that qualifies for Welbe Health, can they be side by side with the Medicare Advantage, or they have to disenroll?
They would disenroll. So we would do all that paperwork behind the scenes with CMS and DHCS, where we transition them from their current MAPD plan to us.
Okay.
And that leads to another question. How are commissions paid? Are they paid through the agency, or are they paid direct by Welby?
So we pay direct to agent as long as that's how it's designated. We pay directly to the agent.
So as an agency, we most likely, we will be delegating Welby to go ahead and pay the agents directly. So you'd get reimbursed directly from Welbe Health. And I'm assuming following the same payment cycles as a Medicare Advantage, that they're paid the month of effective. So if it's effective 2/1, we should be getting the reimbursement by the end of the month to pass that on.
That's exactly it. Exactly. And then the other thing is we do have the chargebacks. So I always tell people, if you can get them to their 91st, 92nd day, really into that 4th month, they're going to stay with us.
Okay.
So I have very low, what I call rapid disenrollments.
Yeah.
I have very low rapid disenrollments with the broker channels. So that's not a problem. And if something comes up where your agent or your client has a concern, give me a call. Let's see if we can find the solution or help them figure out what next steps they need to take so they get comfortable with the process with us.
And I had the pleasure of visiting their Long Beach site.
Yes.
And I have to say that it's absolutely beautiful. If you'd like to take a tour of the facility, I'm sure that we can work with Welbe Health to schedule an in-service. But the facilities are wonderful. They're very well set up, and the quality of services that you're rendering, you could tell that they're very high.
Thank you.
So you can feel very comfortable that we've vetted Welby and the facility, at least the one in Long Beach. And I didn't know that you're part of Sutter Health, which is a huge healthcare organization, top rated. So the fact that you're with Sutter says a lot about the level not only of the service but of the organization behind it. So agents, you can feel very comfortable that this is an organization that that's well established and here to stay. PACE has been around for quite some time.
Yes.
So this is a great option for those individuals, especially under the 65 population that are going to qualify for this program. We all know that, especially in the Hispanic community, there's a ton of diabetics and other chronic diseases, unfortunately. So this is another opportunity for you to help your clients. Any other questions, Rodrigo?
There are no other questions. Thank you so much, Angie, for the presentation.
I do have 2 dates coming up in Long Beach that they can come by. We have a Senior Saturday, the first Saturday of every single month from 11 a.m. to 2 p.m. at our Long Beach site. This is a great opportunity to bring clients to see us.
Wonderful.
It's almost like a sample of the program for the senior too.
Yeah.
And families, sometimes sons, daughters, nieces, nephews, they want to come see it.
Right.
They want to see it with their own eyes before, their loved one joins.
Yeah, the caregiver is so important in the process, for sure.
Saturday, if they're working families, Saturday gives them an opportunity to come and see us.
Awesome.
And then the third Thursday of every month at our Long Beach Center, we have a community and broker mixer from 4 to 6. So they can come by and see us take tours. There's raffle prizes, get to know our staff, and it's just another opportunity to get to know us.
Awesome. I say we work offline and work on a calendar for these events so that we can get some RSVPs.
Yes.
That way you know who's coming out so that you can greet them personally.
Yeah, absolutely.
And then in regards to the certification process, it's online.
Yes, so we have an online version of it, and then we have in person. I'm actually scheduling trainings throughout LA right now.
Okay.
I can also, if you want to schedule with me for in
we'd love that.
person here, I can do that too.
We'd love that. We'll talk after this session of iPros TV, and we'll not only coordinate some agents that want to go out and visit the sites during those open houses,
Yes.
but we'll also work on a in-person certification training, which I think is very helpful. Yeah, and I'm sure they're going to have a ton of questions and just some great questions presented here today. Anything else come in, Rodrigo, during this session? Well, thank you so much for coming out. Very
Thank
informative.
you.
We're very excited about this partnership with Welbe Health. It just gives us one more product to educate our community. And we all know they're out there, right? It's just
Yes.
having the information, feeling comfortable with our new partners, Welbe Health, which you
Yes.
should, which again are part of the Sutter Health family, which is one of the top-rated healthcare networks in the state of California. So with that, we want to thank you for being here as our special guest, and stay tuned for our next session of iPros TV. As always, you'll be receiving a follow-up link where you can view this at your leisure, and also for those agents that couldn't attend, we'll be sending that out to them so that they can get this valuable information. So once again, thank you. Happy Monday. Have a great rest of the month, and see you next time.